awarded heart surgery for democratizing heart care in India.
Whether the patient sitting in front of him is a paying patient or a free patient, that is immaterial for him.
He's built the world's largest and also the cheapest heart care institute.
As a doctor, he is very caring. As a businessman, he is very smart.
He's a man who proved that a low-cost healthcare model can also be profitable.
It's really a numbers game. I mean, it's really about using large numbers to bring down the cost.
He is Dr. Devi Shetty of Narayana Hrudayalaya. Spread over 25 acres, 2.5 hours from Bangalore, Narayana Hrudayalaya's health city is the first of its kind in India. It has on its campus the world's largest heart and cancer hospitals, a specialty hospital for orthopedic and plastic reconstructive surgery, an institute for organ transplants, an eye hospital, and even training and research institutes. Every day, 3,000 people make it here, and none of them are turned away, not even those who cannot pay for treatment. In fact, this hospital does 50 to 60 free surgeries a week. Because the man who founded it has one mission: quality healthcare for all, delivered with dignity. We met Dr. Devi Shetty on a busy Friday afternoon. As he took us around the 1,000-bed cardiac care hospital, the simplicity of his business model was striking. Let's take his pediatric cardiac unit for instance. It's the largest such facility in the world and at any point of time handles 50 to 60 cases. This is probably the number of cases that other hospitals would handle in a year. So following the simple economies of scale logic, a cardiac surgery that would normally cost 3 to 6 lakh rupees in every other hospital is done here for a mere 60,000 rupees to a lakh and a half.
A low-cost, high-volume model will give me very different operating leverage on man, machine and material. Across the chain, whether it is for materials, that is drugs and consumables, whether it's for medical consumables, whether it is purchase of capital equipment in terms of medical, large, high-value medical equipments, whether it is in terms of ability to exploit your human resource better.
Any disease affecting the heart, written in the book, it is all here.
This means that 200 doctors in this cardiac hospital have surgeries that they've mastered. It's no surprise then that Narayana Hrudayalaya has a success rate of 95%, better than the best hospitals in the world. When you hear people say that you're the Henry Ford of the healthcare industry or heart care business, you're the operating machine, you're the man who sort of invented the factory model for heart care in India, how does it make you feel?
In a way, I feel happy that India requires 2.5 million heart surgeries a year. Less than 90,000 privileged people undergo heart operation and the others die. So we have to look at some other model.
In the process of building Narayana Hrudayalaya, you've done 3 other heart hospitals. But what was the vision that drove you to start Narayana Hrudayalaya 10 years ago?
Only one purpose, that is to democratize high-tech healthcare. We want every man, woman and a child in this country, if they ever require a heart surgery, they should be able to have it with dignity. We thought unless you adopt the business principles, you can never bring healthcare to everyone. If I do free heart surgery, how many free heart surgery I can do?
This whole business of Walmartizing healthcare in India especially, people say that if you pursue wholesale volumes, you may give up something and that something is perhaps going to be quality.
No. I'll give an example. All over the world it has been proved that a surgeon who is doing 3 operations in a day is better than a surgeon who is doing 3 operations in a month. If you want better results, you have to depend on the volume. This is not selling a Rolex watch. It's a business wherein you have to keep on doing in large numbers from morning till night.
I've heard several things being said by C.K. Prahlad about your business model, about how you go after skills, not credentials, about how you know how to leverage human resources, about how you know how to leverage financial resources. But how do you bring down the average cost of heart surgery from 10 to 20,000 in the US down to, if I'm correct, 2,000 now at this hospital.
Our target is to do a heart operation for $800.
Okay.
And in 5 years we will reach there.
Okay.
Now, how do we accomplish this cost reduction? First thing is, when all the other hospitals are doing 2 or 3 heart surgeries in a day, we do about 35 heart surgeries in a day.
Right.
Last year we implanted the largest number of heart valves in the world.
Right.
Every heart valve maker in America wants to sell his valve to us.
Sure.
So we obviously control the price. We do about 10 to 12% of the heart surgery.
So how much of the